Even on mere inspection, an abnormal head size will draw attention. Here too, as mentioned earlier, the head circumference must be measured and entered into the percentile curve. Apart from head size, the head shape must also be observed. The elongated shape of this child's head is the result of premature closure of the sagittal suture. This is known as scaphocephaly.
Even if the skull shows no obvious abnormalities, the sutures and the fontanelle must be palpated. In young babies, the sutures are particularly easy to palpate. The level and tension of the fontanelle must be palpated in an upright position. The child should not cry during the procedure. The anterior fontanelle is measured diagonally from front right to back left. The anterior fontanelle closes between the 12th and the 18th month.
Nasal patency is observed. If a child's nasal breathing is difficult, we must consider the presence of foreign bodies, quite apart from anatomical abnormalities.
Especially a one-sided or bloody secretion is a sign of the presence of a foreign body. Chronic rhinitis often extends to the paranasal sinuses. Of the paranasal sinuses, only the ethmoidal cells are developed from the time of birth.
An inflammation of the ethmoidal cells shows in swollen eyelids. Ethmoiditis is a dangerous illness.
The other paranasal sinuses are only pneumatized later as the child grows. This is why infections in the maxillary sinuses become increasingly frequent only from the 4th year. Frontal and sphenoid sinusitis is not normally found until the child is of school age.
In a normal examination designed to show the child's health status, the eyes undergo only simple tests. It is important to look for a strabismus early on. To do so, try to interest the child in the light of a small lamp.
The light source should come from the observer's direction. It is best if the examiner can have the light source on his forehead. Once the child fixes his eyes on the light, watch whether there is a symmetric image of the reflections on the cornea. One eye may now be covered at a time, while the other eye is being observed. If this uncovered eye makes a movement designed to adjust, this indicates a strabismus. It is important to cover the eye as close to the child as possible without actually touching the child.
In this child, the asymmetrical position of the corneal reflex indicates strabismus. By covering one eye, it is possible to see how the uncovered eye makes an adjustment. This test enables the recognition of a small deviation.
A motility test also helps to distinguish between concomitant and paralytic strabismus. In concomitant strabismus, the deviation remains the same in all directions. In paralytic strabismus, there is a deviation only in the direction of the affected muscle. Here, for example, the left rectus lateralis muscle.
Since a baby's binocular vision is fully developed at the age of 6 months, any strabismus must be clarified by 6 months at the latest. This also means excluding other factors which can cause the axis of the eyeball to deviate.
This child's left pupil appears yellow. He suffers from a retinoblastoma, a retinal tumor.
The sclerae are normally white and smooth. If the sclerae are thin, they appear blue. Osteogenesis imperfecta results in blue sclerae. In jaundice, too, the sclerae are affected. Like the skin, the sclerae turn yellowish.
On irritation, the conjunctivae usually react unspecifically with greater vascular injection. This gives the impression of red eyes.